And it is my pleasure and great honor to be able to introduce to you Pamela Hyde. And Pamela Hyde is the administrator of SAMHSA, which is the Substance Abuse Mental Health Services Administration of the United States Department of Health and Human Services. Pam Hyde was nominated by President Barack Obama and confirmed by the United States Senate in November 2009. Ms. Hyde is an attorney and comes to SAMHSA with more than 30 years of experience in management and consulting from public health care and human service agencies. She served as a state mental health director, state human services director, city housing and human services director, as well as CEO of private nonprofit managed care behavioral health firm. It is my great pleasure and my honor to introduce Pam Hyde, who is also, I think, a fearless supporter of children, youth, and families. Pam?
I actually think that it is cruel and unusual punishment to have to follow that. Thank you to Decipher Dance, if you're still in the room, that was great. Yeah, you can clap for them again. How many of you have that much energy? Good. How many of you remember having that much energy? Yeah, a lot more of us. So it is great to see the youth here. It is great to see their energy, and it's always great to be here celebrating youth, because that is what this is about. And I really want to thank the Federation for the work that you do on behalf of both youth and families. So thank you, Sandra. SAMHSA has a goal, so I have to get a little bit serious here with you today. SAMHSA has a goal, and that is to make behavioral health a part of healthcare and a part of health in our country. Now, yes, you can clap for that. Anytime I talk to a kids group or a group of people who care about children's mental health issues, I always think of people in my life. So I don't often talk about this, but my youngest son is 36 years old, and when he was about 11, said, "If life is like this, I don't think I want to live it." And that was difficult and shocking and a struggle to try to think about how to deal with. We were fortunate enough to have enough money to pay for a private school that really understood those kind of issues and could help him out. He is a very effective and efficient adult now and doing just fine. Thank you. But I also have to think about the Thanksgiving card that I just sent to my godson, who is 19. And who is unfortunately spending Thanksgiving in a substance abuse treatment facility. He is struggling and continues to struggle. His mother, my friend, is a mental health professional, but for her ability to negotiate and navigate the system on behalf of my godson, I am pretty convinced that he would either be in jail, prison, whatever, at a young age, or not here at all. So I am always thankful in these days. It's time for Thanksgiving, but I'm also thankful for people like you who celebrate the positive, who understand the needs, who advocate, who just don't shut up. And that is what I thank you so much for on behalf of all of us. So thank you so much. So SAMHSA's goal is that behavioral health is essential to health. Now, it is true that behavioral health is essential to health care, but it's also essential to health. And it's time, as some of you have said on the video that we heard earlier, that behavioral health issues should be treated just like any other health condition. They are any other health condition. We still, however, don't think of them that way. And frankly, looking at emotional health development and development of resilience and development of skills to manage life's emotional ups and downs and behavioral health issues is something we also don't pay a lot of attention to. I like to think about this as protecting ourselves against lost hope is just as important as protecting ourselves against bad water or contagious disease. It's a public health issue, and it's one that we all need to embrace in order to have our communities, our families, and our individuals be healthy. In the last 4 years, SAMHSA'S been operating in an environment where this belief about public health and behavioral health is in that role has been supported by this administration. And frankly, I think we have a country who is starting to tip the scales. We're starting to see that move over to understanding behavioral health issues, mental health and addiction issues in a very different way. And I think after a week and a half ago, the election, I think it's pretty clear where we're going with health care for the next 4 years. And while there are lots of unknowns, I think we're pretty clear that the Affordable Care Act is here to stay and that we are going to be implementing it despite many unknowns. The Secretary has strategic initiatives to increase the focus on behavioral health. She talks about transforming health care, and we talk about transforming behavioral health care. She talks about improving the health of the nation, and she's one of the most biggest advocates for that, meaning behavioral health as well. She is a strong advocate for promoting the healthy development of children, including mental and emotional well-being. So we know really a lot these days about the critical importance of behavioral health to children and families. We just don't always do what we should about it. It's pretty clear that none or too little prevention or intervention or treatment means rising costs. We know that about a quarter of pediatric visits have something to do with a behavioral health issue. We know that about half of the people in America who need mental health treatment get it, and less than an eighth of the people who have substance abuse issues get those the services they need. And yet, the annual financial burden just for child abuse and trauma issues is $103 billion. And the economic costs of mental, emotional, behavioral health disorders among youth is $247 billion. These are dollars that can actually be counted for when we don't pay attention to the emotional health needs of our children. We also know that on average, the symptoms of a behavioral health issue start at least 6 years before a young person is actually identified and services are provided. So those are 6 years in which we could be intervening earlier, making sure that children don't get to the level that they often do because we don't know what to do about them or their issues, and when we're not helping the family address those issues. So when we don't invest in children, we have poor educational outcomes, we have lost productivity, we have mental and substance use disorders, we have greater physical health problems, and we have incarcerations, all of which cost all of us, not just that child and not just that family, but all of us. Investment also is the greatest influence on a child's well-being. So parents, caregivers, those are the people we need to invest in as well. Between 50 and 80% of child abuse and neglect cases that are seen through child welfare systems involve some degree of substance misuse by the parents or in the family. We know that prevention, treatment, resilience, and recovery must occur in the context of family and community, and that's where we need to spend our efforts. So SAMHSA'S work, we've been doing a lot of work around this public health approach and a preventive approach to behavioral health. It's a major focus in our administration. Actually, in the Surgeon General's National Prevention Strategy, emotional well-being is actually included, as is the prevention of alcohol, substance abuse, and mental health issues. The 2009 Institute of Medicine report, Preventing Mental, Emotional, and Behavioral Disorders Among Young People, make it very clear that it requires both intervention at the individual level and at the family level, and it also makes it clear that it needs to be intervention at all levels, faith-based, schools, officials, in the community, in the family, etc. So SAMHSA'S been working really hard at this issue of building resilience. How do we do that? The study of resilience makes it clear that a strength-based approach to understanding people is the way we need to go. Characteristics of resilient individuals include physical competence, social and relational competence, cognitive competence, emotional competence, moral competence, and spiritual competence. I once said that if we spent as families, if we helped our families spend as much time learning emotional skills and teaching emotional skills as we do soccer skills, we would probably be much better off in our country. And we don't help families do that. We don't help them know best how to do that at very young ages. We have lots of examples in SAMHSA about work we're trying to do around that, from our Safe Schools, Healthy Students program to our work with other agencies in doing StopBullying.gov, a new government-wide initiative to prevent and stop bullying. We have a program that I'm sure many of you are aware of called Project Launch, which incorporates mental health consultation and primary care and mental health integration and state and local links. We have home visiting programs now that actually include substance abuse and mental health and depression screening. The WIC program, which is Women, Infants, and Children's program, that is about women with young children and their food needs in addition to their emotional needs. That covers about 50% of all the babies born in the United States, and WIC is now screening for maternal depression, which has an impact on the development of children. There's a new HHS Early Childhood Development and Health Coordinating Council, and SAMHSA also has, as you know, the National Child Traumatic Stress Network, which is an evidence-based clinical interventions and trauma services, training and consultation. And at this point, about a quarter of the children served through that program are less than 6 years old. The point here is we are focusing very hard on young children and families supporting young children so that we can make emotional health development and resilience and skills development a very big part of the development of kids and their families. We have lots of new partners in these efforts, and that are behavioral health partners and healthcare public health partners, because increasingly people in the public health arena are understanding that behavioral health is critical to health as well. There's lots of new opportunities coming. The Affordable Care Act is already in gear and going to kick up even further. We know that children get health care and behavioral health care if parents are able to do so, if parents understand and are able to access that. Unfortunately, right now, we still have 42% of parents below the poverty line and 33% between 100 and 200% of the federal poverty level that do not have coverage, do not have a way to pay for health care, which means they don't have a way to pay for behavioral health care either. But by 2014, they will have a way. They will have coverage, and that will be a major change in our country. We already started, the Affordable Care Act started, and it's already in place that children up to age 26 are able to be on parents' commercial insurance policies, and that is hugely helpful for parents who have a young person with behavioral health needs. We also have, the Affordable Care Act has also already implemented the no denial for pre-existing conditions for children, and that includes serious emotional disturbance and other behavioral health disorders. And that will also be true for adults beginning in 2014. So the children have already come on in 2014. Adults will not be able to be excluded for pre-existing conditions either. We also have something called qualified health plans that are going to be in place soon, providing a network of providers, and the language explicitly includes, for the first time, mental health and substance abuse providers have to be in those networks. We also have rules and regs out now about essential health benefits that include mental health and substance abuse as an essential category, and it has to be provided at parity. There are home visiting programs, as I told you, that are already including substance abuse, and we have health homes that are provided by the Affordable Care Act that include mental health, mental illness as one of the high-risk conditions. There is so much about the Affordable Care Act that has such positive implications for behavioral health, for families, for children, for adults that need that care. Now, you all know about early childhood events, adverse childhood events, and the relationship between those and trauma experienced by children and their families. And you know that those traumatic events get in the way of healthy development. We have pretty good and growing evidence that those ACEs, or adverse childhood events, which can be things like physical or sexual abuse, exposure to violence in the community, divorce, death of a parent, or in some cases, living with a family in which there is an adult with alcohol abuse, etc. Those kinds of things put children on a difficult path. And we have pretty good evidence these days that a quarter of adult mental disorders start before the age of 14, and half of them start before the age of 25. All of this is to say that this is why SAMHSA is focusing on young people and youth and their families in our prevention efforts, as well as in many of our treatment efforts, because we know it not only helps the adults, or it not only helps the kids, it not only helps the families, it also helps us address the adult issues in our country. We know that young children who are exposed to 5 or more significant adversities in childhood, in their first 3 years of childhood, face a 76% likelihood of having 1 or more delays in cognitive, language, or emotional development. These are huge risk factors that we can do something about. We also know that the more ACEs experienced, or adverse childhood events experienced in childhood, the higher risk there is for health problems, in addition to behavioral health problems. So there's increases in suicide attempts, in heart and liver problems, in diabetes and obesity, pregnancy problems, substance use, high stress issues, family, and other issues when there are more adverse childhood events in childhood. Families and caregivers are essential partners in supporting children, and they're essential in promoting their resilience to have healthy, both physically and behavioral health adults. So SAMHSA is doing a significant amount of work in the area of trauma. Childhood exposure to traumatic events is a major public health problem in the United States. Early childhood trauma affects brain development, and brain development has a clear role in susceptibility to addiction and to mental disorder. 60% of the children in our country are exposed to violence within the past year. 60%. Saw it in the community somewhere, saw it at the schoolyard. 8% report a lifetime prevalence of sexual abuse. 17% report physical assault. Almost 40% report witnessing violence. And adolescents in substance use treatment, and for those adolescents who are in substance abuse treatment, 70% of them had a history of trauma exposure. And we also know now that childhood trauma explains about 32% of adult psychiatric disorders of various sorts. Almost 35% or over 35% of children exposed to a single traumatic event will develop serious mental health problems. And unfortunately, sometimes navigating the very systems that are supposed to provide treatment, support, intervention, and help actually traumatize or re-traumatize both children and their families. This is something that we have to keep working on. So SAMHSA is working to create a trauma-informed approach awareness. We have a draft concept paper about trauma-informed approach that's going to be coming out for public comment soon. I hope you'll take a look at it and comment. We have working definitions of trauma in there and of a trauma-informed approach. And trauma we think of as 3 E's. It's the event itself, it's the experience of the event, and it is the effect. And those things may be different for different children, for different adults. For trauma-informed approach, we think of it as 3 R's. That we realize that trauma is pretty ubiquitous out there and that there are potential paths for healing. We recognize the signs and symptoms of trauma in not only staff and clients, but also in organizations, and we respond, fully integrating trauma into policies, procedures, practices, and settings. So SAMHSA has prioritized children and youth. We've prioritized prevention. We've prioritized attention to trauma and its impact. And we have prioritized collaborations with families, with other organizations, with primary care, with other child-serving agencies, and certainly with advocates such as the Federation, all to improve America's health.